What can we learn about the mysteries of autism by combining artificial intelligence and Canada's valuable health data? That is the question posed by Dr. Christine Armour, pediatrician and geneticist at the University of Ottawa and a physician scientist at the Children's Hospital of Eastern Ontario. Her team has published the first study of its kind to see if machine learning can effectively analyze health data on mothers and babies and possibly turn it into a tool to find children at risk of ASD early. That's because studies show early detection and treatment can improve the outcome.
For at least this first step, allowing AI to sort of say, take all this data, look at it, please help us recognize these individuals who are more likely to have ASD.
In Canada, 1 in 50 children are diagnosed with autism and the spectrum of related disorders. There isn't a single medical test. Most are identified by parents or doctors or teachers. And the rates of diagnosis vary wildly across the country. But could there be a more standardized way? And can machine learning find those clues tucked inside the vast amount of medical information collected in Canada?
The uniqueness of this really leverages the Canadian strength of our data. It's incredibly very large and rich data set.
Welcome to the Canadian Health Information Podcast. I'm Avis Favaro, the host of this conversation, and this is about harnessing AI and data to get a deeper understanding of autism, all to help children and families. And now we welcome to the podcast Dr. Christine Armour. Welcome.
Thank you very much for having me.
I like to think of this podcast as helping people understand about how to use AI to try and understand this big mystery of autism spectrum disorder. Does that fit?
Yeah. So I think people are becoming more and more familiar with AI. You hear about it in chatbots, you hear about it in the news in all kinds of ways, but we're trying to channel it in a positive way to leverage healthcare.
Right. Now, you have a long history of looking at prenatal diagnostics, and you are a geneticist and been involved with screening programs here. Why is early detection important? Why have you dedicated your professional career in that area?
Yeah. So I'm a passionate believer in screening and healthcare systems that take care of the population.
Why? Explain to people what screening is and what the goal is.
So screening is really a way of capturing the whole population and consistently checking everybody so that people aren't falling through the cracks. That's one way of thinking it in very layman terms. But it's less about just relying on people to recognize whatever symptoms or findings or whatever concerning features they may have to bring them to healthcare's attention. And so it's a whole system that gets put in place to take care of the population.
What other things do we now regularly screen for?
Well, there's many examples of excellent screening programs in the province. There's Cancer Care Ontario screening programs. There's Newborn Screening Ontario. There's many screening programs that allow us to detect different conditions. This would be a different kind of idea. Would be like a later on in childhood, so maybe early on in childhood as opposed to anything to do prenatally or later on in adulthood. But the idea would be to provide early diagnosis and care, or at least offer resources to families.
So do we have a screening program for autism?
Not in the way that I'm talking about screening, in sort of like a system-wide screening program that would screen every child. We have screening in the sense that maybe healthcare providers or caregivers or teachers may apply different developmental tools and keep an eye out for some of the features, but not in the sense of something that doesn't require someone else to say, I wonder if there's something going on.
So your opinion is that we need some sort of screening program of this early stage, because otherwise kids will get missed with autism spectrum disorder.
I think certainly it would offer opportunity for children to access intervention and resources early on if that's something that would benefit them and their family.
Do you see kids that are being diagnosed too late?
Yeah, I mean, that is something that definitely, unfortunately, happens. There are many individuals who will get an early diagnosis. But I do have parents that I meet in clinic who express some sense of frustration or sadness or even guilt sometimes that maybe they were late to diagnosis and maybe missed some opportunity for support.
So this is diagnosis 4, 5, 6, 7, as opposed to ideal diagnosis would be 18 months to 2 years.
Yeah, I think in that range. I mean, I want to clarify that I'm not an autism spectrum disorder specialist. My sort of role in this project was having a foot in many different areas of expertise.
Yeah.
And so I come from the clinical perspective, I come from the screening perspective, and then I also come from sort of a research perspective. And I'm not an AI scientist, but one of my roles is to help bring all these people together.
The choir master.
I think that's one way of thinking about it.
Yeah, okay. So why AI? Why did you say, okay, let's become the first to try AI to help us solve this question about autism and how to pick it up early?
Yeah, I mean, we all hear about AI being so prevalent now in the news and society and chatbots and whatnot. And I think we came at it from the perspective of, well, we have access to these very large, very rich, incredible data sets. We're very fortunate from that perspective in Ontario and Canada. And AI is in one ways a very good tool to look at some of these very large data sets. It can look and find these complex associations that traditional statistics may not be able to find. And so it's really, when you're handling, for example, 1.4 million data points, that's where AI, I think, really has the ability to tease out very, very subtle little differences.
So you're saying this is not anything a human could do easily. Were you wary at all of AI prior to this?
I think everybody's wary to some degree, right? But I think a few things. One is we went into this very aware. I have excellent AI scientists working with me. And also we have a framework at the Children's Research Institute for Responsible Use of AI. And I like to think we're coming into it with a very good understanding of some of the biases that are in the data and some of the limitations of AI. It's really not the end all be all. It's not a perfect tool by any stretch of the imagination, but like any tool, there's really pros and cons.
What you set out to do was take all this data that's available in Ontario because Canada has this universal system and we have data sets like Chi-Hi and others, right?
Yeah. So it's a pretty fantastic cohort. So it's 1.4 million total of pregnant individuals and child pairs that's linked to these other sources of data within the systems that we used.
So then how do you use the AI and what did you tell the machine to learn?
So this gets into AI subtleties, but basically we design ways of linking all those data sets together across the different databases and then coding them in a way that the AI can use, and then using these different transformer tools to input this and let it teach itself to look and see what were the features across the system. What you need for something like this to work also is a cohort of individuals already with a known diagnosis of an autism spectrum disorder, which ICS did have.
And ICES is the Institute for Clinical and Evaluative Sciences in Ontario. So you had 10,000 children with a diagnosis of autism spectrum disorder that you matched against the 1.4 million.
Correct. Yep.
So you tell the machine to look for associations. I think I read somewhere that it's teaching the machine and you give the machine permission to go look for things.
Yeah, I think that's a good way of looking at it. We give it all this data and we say, here are the outcomes we're looking for. Go mine all this data and look through it all and see what helps you find that outcome.
So what did you find?
We found that we could detect cases, that we could model this data, but work really remains to improve the prediction tool. The AI will pick all kinds of different features, and we don't always know everything that it's using, and it will use all kinds of features to a little or some different degree. And we can look at those features through something called the SHAP analysis. That's a fancy AI term that looks at explaining what the AI used. It's kind of like looking at under the hood of the car and trying to figure out how things are working. And there's many, many features, but we just chose the top 20 that it was looking at to sort of show some of the things that it recognizes. And this is where I'm a little bit hesitant of attributing, I wouldn't want the listeners to think, oh, that's going to cause autism. A caveat, if you will, with so care and how that's presented. The list of conditions in which the AI was using in some fashion included the offspring sex, feed type categories, birth weight, maternal mental health conditions, numerous newborn screening analytes, and a number of others such as gestational age at delivery, labor type, etc.
Mm-hmm. And the machine picked those?
The machine picked those. Or I should say it's using those in some fashion to help it analyze. But keep in mind, there's many, many more on that list that I haven't read out. There's, probably hundreds of other aspects that are contributing tiny contributions to how it uses those. So I think that's the beauty of AI, that it's not necessarily focusing on one genetic condition, for example. It's looking at many, many, many aspects of many conditions to say these are all the things that weight in one direction or the other.
It's an initial look at it. Did anything in that list that the AI found surprise you?
I think there's always things that make us kind of scratch our heads and say, why is it looking at those sorts of things?
Like what?
And I think, sometimes different flags on the newborn screen. And sometimes, was there a wound on the head or things like that? There's very unusual things that it's picking up. And I think this is where I want to come back to reiterating that you don't know what's actually triggering that necessarily within the system. And so you have to be cautious about that.
Does this open the door to other research, tracking down these leads that AI is giving you?
Yeah, absolutely. I think one is just to come back to the very principle of the study, which is that you can look at these very large, incredibly rich data sets and use AI as this fantastic tool to leverage insights from all this data. So we chose autism spectrum disorder because it's a common diagnosis within the population. I think this kind of a study asks the healthcare system to look at how to take care of us without us going out and finding each of these cases. I truly believe that these kinds of systems, like a screening system, automate some of that care and at least makes it very consistent across the population. We'd like to develop that more because this study was very foundational, very sort of, can we model this data? Can we look at it? But we'd like to take it further, look at more data, see if we can build it out to actually get closer to something that might be usable.
Now, this is the first study of its kind using AI with ASD in Canada, right?
Yes, in Canada, absolutely. There was a similar study out of Australia, but ours was really to use this scale of health administrative data with state-of-the-art transformer deep learning models. And so the uniqueness of this really leverages the Canadian strength of our data. It's incredibly very large and rich data set.
Right. And the data that you get from AI is only as good as the data goes in. So a lot of countries can't even do this sort of a study.
And that's where I put a plug in for the Canadian healthcare system and our approach to how we collect data, because we definitely respect the privacy and the nature of that data. But then we're also able to use it in ways like this to look at all kinds of different healthcare questions and figure out how to move the healthcare forward and figure out where the gaps are.
When it came to its ability to predict autism, you came out with a couple of numbers on how well this first iteration could predict. What did you find?
So it worked reasonably well. It certainly is nothing close to what you could actually use to screen a population, but it is able to recognize some of the cases.
Okay, I think it said 70% and 59%.
Around 70% for predicting, with the sensitivity around 71% and a specificity of about 57%.
You would really need to be you'd need to be closer to like 98, 95.
Yeah, in the higher 80s at least. And this was really just hey, can we do this study? Can we model this data? Can we get anything like this to work? So it's really, really very a first look at this kind of work. As we move forward, I think it would be, one of the things we're very cognizant of is involving families and individuals with autism spectrum disorder to help us figure out, okay, what could this look like? If we can build this, what would you envision as being something that would be helpful to you and your family members?
Good. I think they'd appreciate that. So now the idea of early diagnosis is early treatment. Do you see that there's a disconnect, that you might end up finding more children if you do have a screening program, and that the treatment programs aren't not at the point that's going to service these kids if they do get diagnosed early?
When you have a system that can predict what the needs are, for example, when you know what specifically how many are there and how many are coming, it's much easier to plan health human resources and structure a healthcare system around the needs of that.
So the data needs to come first, and then that really is the push for more resources.
Yeah, that's certainly a strong possibility.
Okay. So when do you start your next study?
Yeah, so we're just getting started on that piece of work and, hiring on more bodies, and it'll be finding the other data sources, bringing them in. We have our family collaborators on board and other experts within the autism treatment world. So it's bringing that all together and get going. I think this next phase, we're looking at around 2 years before we expect to have some output.
A wildcard question here. Are you going to put in vaccine status? Given that that's an issue in the United States, questioning the role of vaccine in autism?
It's not something we're actively planning on. Now, whether or not that is going to be in any of the other large data sets, I don't have an answer off the top of my head. I'd have to go back and look at the data.
Given that the overriding understanding about autism is that it is at its core genetic, there's some 500 genes that are linked with autism. How does AI and the way you're using it complement that?
You're right in that we believe there's definitely a genetic component to autism. It's probably very complex genetics in many cases. So certainly in a proportion of individuals with autism, we can identify a genetic change, but not necessarily for many individuals with autism. And so this sort of data approach that's very agnostic of what the contributors are, right? We may not know what's causing it. We may not even really need to know for at least this first step, but that allowing AI to sort of say, take all this data, look at it as AI does, and please help us recognize these individuals who are more likely to have ASD. It removes that need necessarily to understand what are the factors. It just tells us, yes, we can find these individuals who might be more likely to have it.
It's taking the politics out of it.
It's taking the politics out of it, and truthfully, something like autism is probably many little contributors, be they genetic, be they, I'm using air quotes, you can't see me, but quote unquote environmental, right? So that's not to mean like pollution or something, but things that we're perhaps exposed to over a lifetime. And it takes all these factors that are all very complex and allows us to analyze all of them at once.
So how will you know if you've succeeded?
I guess what that defines what does success look like. I think success would be a program or a model that's very good at identifying what cases are more individuals who are likely to have a diagnosis. So there's a few things that one, we have to have good enough metrics. You mentioned, for example, having over like a 90% sensitivity and specificity. We would need to have that. We would need to have it at an age that's at a window that makes early diagnosis and the offer of treatment or offer of resources useful. And the other thing is as I mentioned, we want to circle back to the families and the individuals with autism, like what does success look like to them?
Okay, let's assume this all works and you get a system that's good. Where do you see it being used? What could the future look like in terms of autism spectrum disorder diagnosis?
I mean, I could imagine that you could have a program that works relatively real time, right? So it collects the data that we have at any point, right prior to when we would like to have this information. So, for example, through the gestation of the mother, the birth, the early years of the child, to say, by 2 years of age, we would have this information. It would be ready to go. And we could issue some kind of a result that would guide that individual through the healthcare system. But, this is very, very future looking. We're quite a ways from this still.
Got it. So I guess to summarize, I would take it you're an AI fan.
Yeah.
You're not in the fearful category because you've dipped your toe in the world of it.
I think it's like any other tool, right? And I think it's like any other tool. It's going to need safety strategies and responsible use. But with those in place, you could actually have a very powerful tool at your disposal.
Okay. I guess my last question is, how does it make you feel as a clinician and a researcher?
Hopeful that AI can help us in ways that we've struggled, to be honest. There's all this data. The AI can help us mine this data to find different ways of leveraging the healthcare system.
Thank you so much for your time, Christine. I really appreciate it.
It was a pleasure, and thank you very much for having me.
Autism is a very complex condition, and as Dr. Armour mentioned, this is very preliminary work. But if you want to see the findings and learn more about the team behind it and the agencies that back this work, we'll post it on the CHI website. Go to cihi.ca. And that's where you'll see much more data about Canada's health system. And remember to subscribe to this podcast on your favorite player. I'm Avis Favaro. Thank you for joining us and talk to you next time.